Good evening and happy Sunday to you. I'm excited to be live. This is actually my first time of coming live on YouTube because YouTube was giving me restriction. Your followership level, like people have not subscribed. So what I usually do every Sunday is that I'll just come online, like upload videos. So today, thank you for all of you that subscribe. I'm grateful. Please, if you're just joining, like, subscribe and share so that you'll be getting new notification each time we come live on YouTube. Okay, so here we go. Today is actually for telemedicine, nurses, healthcare professionals, and more. Okay, so our topic today says breaking into telemedicine, opportunities for nurses, assistants, and non-health tech workers. So my name is Engineer Mercy Austin, a DevOps engineer and a digital skill coach. So I'm excited to come your way today, June 22, 2025. Alright, so I'm excited to come your way. Now, what do? We are a digital skill platform that train people on basically demand skills that enable them to work remotely from the comfort of their home using their smartphones, their laptop, their gadget, whatever they have that can access the internet. That is what we do. So that's what we do, and we have a student, and if you want to join us, you want to learn in-demand skill and also start working remotely from home, trust me, you are at the right channel. Alright, so today my target audience for this particular webinar is nurses, midwives, caregivers, lab technicians, administrative staff, health personnel with little or no tech background, people interested in remote healthcare roles. So my targeted audience are nurses, midwives, caregivers, lab technicians, administrative staff, health personnel with little or no tech background, and then people interested in remote healthcare roles. Now let's proceed. Understanding telemedicine and remote healthcare. What is telemedicine? Telemedicine is the use of digital technology such as a smartphone, your laptop, or whatever can give you access to the internet to do what? To offer consultation remotely. So what is telemedicine again? The use of digital technology such as a smartphone, your laptop, and whatever. It might be if you have a MacBook, okay, a gadget that will do what? That will enable you to do what? To access the internet. So with your smartphone, you're able to offer consultation online. So that is what we call telemedicine. Alright. Thank you for joining. Teammates Nancy, please tell me how let me tell other people to join us that we are actually live. So please tell other people to join. Please invite your friends, your teammates, people in the healthcare field. They need to see this. All right, this information is very important for them. All right, so like I said, that telemedicine is the digital technology that enables you to use your smartphone, your computers, to well, anything that could enable you to access the internet to offer what? To provide medical care remotely, especially consultation. That is what is telemedicine. Okay, now the rise of virtual healthcare, that's post-COVID evolution. It actually happened after the COVID-19 era, so we had need for what? Post-COVID evolution. That's when telemedicine actually came up because it wasn't there before. Alright, now we have benefits of telemedicine for both professionals and patients, common myths about telehealth and tech skills, real life examples, nurses, assistants working from home, and all of that. So we already have people working from home, right? So you as a nurse, you are in the right place to know how you can use your smartphone to offer services online, to offer consultation, right? Consultation, also manage EHR records. So we are going to proceed from there. All right. So if you are joining me, I would love to know, have you attended to to a patient virtually before? Have you attended to somebody virtually before, like a telemedicine personnel, like a nurse, a caregiver, a midwife, a doctor? Have you attended to someone virtually before? Let me know in the comments. Alright, let's go right away. Understanding telemedicine and remote healthcare. Understanding telemedicine and remote healthcare. Alright, you need to understand what this is all about. It's about you working as a remote worker, being a caregiver, and getting payment as value at the end of the month. So what are the job roles in telemedicine for non-tech workers? We have virtual nurse. So when you're done learning tech skill, what are you going to do? We have virtual nurse, okay? Virtual assistant nurse, a nurse that attends to patients virtually. We also have what? Tri-age nurse. So you could either be a virtual assistant nurse or a tri-age nurse. We also have what? Medical administrative assistant. These are remote job roles, okay? Medical administrative assistant. We also have remote medical biller and coder, telehealth coordinator, patient support specialist, remote data entry, that is health record. You know, the same way you take care of health record on site. Remotely, you also do what? Handle health record. Okay, so who are the people that hires telemedicine personnel? Health caregivers, hospitals. A lot of hospitals are looking for nurses. Eventually, nurses feel I am okay working on site. They do not know that they don't even need to travel out of Nigeria. You don't need to travel out of the country to land yourself remote jobs and make good money. Okay, you don't need to jackpot. You can absorb the work, make your money from the comfort of your home. So who are the people hiring telemedicine personnel? We have the hospital, private clinics, health startup, insurance firm, SaaS health platform. What is SaaS? SaaS means software as a service. Software as a service health platform. They are the people hiring telemedicine personnel. So when once you're through, you can become what? Virtual nurse, tri-age nurse, medical administrative assistant, remote roles, remote medical bills or coder, telehealth coordinator, patient support specialist, remote data entry, health record, and then we move ahead. Now, what are the people employing? We look at the hospital and countries. A lot of people all over the world, because tech skill is actually a global skill, okay? It's global, so the skill is higher, like they hire you globally because you are expect. I was saying somebody, you know that people that are in the health field, that the ones that are getting more payment than an ordinary freelancer. So you being an healthcare personnel is a plus for you, right? Okay, so what you don't need as a telemedicine person is coding. Oh, I need coding. No, you don't need coding. You don't need programming or advanced IT skill. What you need is what? Basic skill that enables you to work and offer services online as a telemedicine personnel. Alright, what are the tools you could actually learn and explore as a telemedicine personnel? Number one, the very most common tools that telemedicine personnel use is what? Zoom for teleconsultation. Zoom for teleconsultation. Of course, you know, for you to have a better meeting, you must do what? Use Zoom. You can use Zoom or Google Meet. Electronic healthcare, EHR, electronic healthcare. That's what you're going to be using to do what? To manage your patients online. Now, you might be working with the hospital, right? And then you still manage the patient assigned to you. Okay. You also have what? Calendly, telehealth platform like Dr. Chrono, and the soft skills needed is just being empathetic, being adaptable, and then communication skill. Alright, where to find remote jobs? So I'm seeing somebody says, yes, but no payment received. I can't really understand that right up. But what I want to say is that once you are done with the skill I highlighted, where do you find remote jobs? There are plenty. Okay, you expect. So where do you find remote job? Upwork, Indeed, Remote OK, LinkedIn, flex job, Nigerian jobber man, there are plenty. And then the remaining package we teach our students in in our platform. Okay, so what you need to start, you just need 30,000 naira. You can start for free, but then you need a small token to do what, to gain the right knowledge and be coached or be mentored, so you be able to what, to do the right things, know the right tools to apply, and where to get the job and how you can get the job. Okay, one thing is to do what, to gain the information, another thing is to know where to what, to apply it. So with just 20,000 naira, you are able to what, access the package and start working remotely as a telemedicine personnel. Do not be left behind, right? This is a global period. This is a tech era. Nurses or people in the healthcare are actually what, hot cakes. Okay, so you shouldn't be engulfed in your on-site work and then earning peanuts. When we have 3 of the nurses in our previous cohort that came, the other one is working for 700 USD, $700 as a telemedicine personnel. That's a huge amount of money. Some of them, when they land this job role, they tend to resign from their work. Then if you still want to go outside, it's fine. Now the good thing is that your job remotely doesn't affect your on-site job, okay? Because you can just do a part-time, you can choose to do full-time. Full-time is between 30 to 40 hours in a week, not in a day, okay? One day is 24 hours. So as a telemedicine personnel, you can do what? Full-time or part-time. Then part-time is what? 20 hours weekly. So you schedule your time, so it will be able to do what? Give you the access to what? To start working remotely. Now, one thing I used to tell my students is that you cannot do it without gaining mastery. Yesterday, we were able to secure some internship spot for our students. So the good news is, as you're enrolling with us, okay, we are not just going to train you. As soon as you're done, we'll be doing what? Giving you a platform to what? To access paid internship. Oh wow! Little skill, we are going global. Okay, so for every one of our students that is committed, we have what? A platform for what? For paid internship, so that you'll be able to what? Gain experience. And you know how much they are paying for paid internship? Some paid internship is between $200 to $400. Can you beat that? So do not allow Nigeria's economy to pull you down or make you lose hope. And now you're thinking of, let me just no. There are people in Nigeria living their best life and working remotely. You too, as a telemedicine personnel, can do so. So enroll in a 5-week digital skill training, sign up for internship, and then start working remotely as a telemedicine personnel. Remember, if you're a nurse, you're a midwife, you are a lab technician, and you are also an healthcare, whatever, maybe administrative staff, whatever your position is, this is for you. Enroll, join, gain the basic skill that enables you to work remotely all over the world from the comfort of your home using your phone as one as a work tool to offer services online. Most importantly, consultation, EHR, that is electronic wake right ahead, and then you are good to go. If you have a question, we'll have to take it. Hi teammates, thank you for joining. We'll have to take your question. Today was for telemedicine, midwives, and everyone. So we are already through with our webinar. Any question? Any question from anyone joining? Please like, subscribe, and you're good to go. Okay. So I hope you've been able to understand what telemedicine is, the use of digital technology, your smartphone. Sorry. Your smartphone, your computer, whatever can help you. Thank you. Thank you, sis. Thank you for joining. Whatever could enable you to do what? To access the internet as a personnel. as a midwife, a nurse, a service provider, okay? That is what we do in telemedicine. So currently, nurses, healthcare providers, okay, are the ones making good money. Their pay is between 700 USD and above. That's alpha. That's 700 USD is actually for a payment, right? So if you want to get an early payment, your early payment is between $20 to $30 per hour. Okay, so that's if you're going for a short, what do we call, part-time job role. All right, so that is it for that. I would love to take your question as we bring the series to a close. All right, so if you're there, understand that the rise of virtual healthcare actually came from what? Post-COVID evolution. And now, the benefit of telemedicine for both professional and patients, okay, outweighs everything because it makes life more easy. Telemedicine brings the patients closer to the healthcare personnel. So a lot of people are making good money. So if you're not making money yet, it's because you are either ignorant of the knowledge or you've not practicalized the knowledge you've known. All right, so that is it about that. Thank you for joining. Please like, share, subscribe, and if you join late, you can as well go back to the recording, right? And then you get everything we've talked about. Thank you, every health worker that joined. I know most of us did not join because we were saying this one is for healthcare providers, but everyone that is trained can work as a virtual assistant nurse, tri-age nurse, medical administrative assistant, remote medical biller and coder, a telehealth coordinator, patient support specialist. These are plenty of roles. Okay, remote data entry. That is you working at what? Working with health record. So you take up the job, remote data entry. So when you say data entry is for everyone. So you can take up that job as a remote data entry and you'll be looking at what? Health record. Your focus is on all the health records that the hospitals know globally. The one that is hiring you, what they are doing, you're in charge of that, okay? And then you're good to go. So if you have not taken the bold step into learning tech skill, please do. The world is actually in the tech era and tech is for everyone. So do not be left behind. Stop struggling with your monthly income. The monthly salary may not be enough because the economy is high. Grab the opportunity, join, learn, and become better. Thank you for joining. See you next week Sunday. My name is Engineer Mercy Bassey Austin. Register, enroll in our next call session coming up July. I'm just okay. Somebody say something. I want to get feedback. Good evening, teammates. Okay, thank you for joining. So register and join our next call coming up in July 13. We'll be glad to have you. Thank you for joining and have a good and beautiful Sunday. Bye bye.